Hey Trent, would you come help me with this line, please?
Yep, no problem here.
If you wouldn't mind getting me some things, I need a sterile ultrasound probe cover, I need 3 Heplock caps, and a handful of flushes. Thank you, sir.
Yep, you're welcome. And where would you like the flushes and the Heplocks, the ultrasound cover?
Okay, so the ultrasound cover, I'd like you to drop sterilely into the kit here, and the 3 Heplocks as well, drop them sterilely into the kit. Okay. So let's do a timeout.
All right, I'll grab the consent form.
Okay, let's sterilize the ultrasound machine. So just be careful here because we got sterile field here and sterile field here. I'll be as careful as I can. And while I'm getting this unfolded, would you mind putting some non-sterile ultrasound gel on top of that probe? Grab the tab. And I got the probe here. Now just pull it along the line. Perfect. So just be careful because this is now sterile. You give me as much length as possible without getting that in the sterile field. I'll just drape this across the patient. Okay, thanks.
You bet. Where would you like the flushes?
I'll take 2 flushes in this well here,
Okay.
and I'd like you to hang on to the other 3. Okay, so before we cannulate the vein, let's just review the checklist, make sure we're not missing something.
Okay, right now I have so far that the site was prepped appropriately, hand hygiene is performed, large sterile drape used to cover patient, sterile gloves, hat, and mask, and all necessities worn by the physician and any person in the sterile field. And patient in the proper position.
Yes.
Now we're on to going to the local anesthetic to start the procedure.
Okay.
Hold on one moment here. We just
Hold on.
Field.
Hold on one sec.
Wait, excuse me, Travis, I'm concerned that you just broke the sterile field and you weren't aware of it.
Look, it's fine, all right? Just give me a second here. This is really challenging.
Now I'm uncomfortable that you realize you broke the sterile field and you're still proceeding.
Trent, if I need your help, I'll ask for it, okay? This is a tough line. I'm trying to get this.
Travis, this is now a safety concern for the patient. We have to stop immediately.
Listen, okay, fine. What's your problem?
Okay, you broke the sterile field. Oh, hold on a minute, Travis. You just broke the sterile field. I'm concerned that you didn't notice that you broke the sterile field with the cord from the ultrasound laying on there.
Yeah, you're right. Good catch. We should start all over, re-prep, get a new kit. We'll start from the beginning.
Okay, thank you.
Thanks, Trent.
So where we are in the checklist, we've flushed the ports, we put the caps on correctly, the catheter is sutured in place. Now all we have left is just the dressing.
Great, okay. These things always confuse me a little bit, and I feel a little more comfortable if you put it on, because you're going to be the one sort of using the line day to day. So here, I'll just hand this to you, and you can put this on. And
well, actually, since it's still a sterile field, it really should be you that puts it on. Otherwise, I'd have to gown up, and we're wasting a lot of supplies. I can guide you through this,
Okay.
but I think it really should be you that places this.
Okay, just walk me through how to do this.
So now that we've placed the line, it's time to dress the line. So we'll need a transparent dressing and a bio patch. Place the bio patch sky facing up. We've placed the line with enough room to be able to fit the bio patch on. Place it facing up. Twist a slight twist to keep it in place. Then you take your dated transparent dressing. The dressings need to be changed every week unless the integrity has not been met, and then it's changed more frequently. So the first section gets peeled off the back, and then the dressing is centered so that the line will fit through this insert. You're going to want a slight amount of blue coming through the hole. Going to secure it in the center first and work your way out. Going to make sure the lines make it through the notch, like that. Once it's secure to the patient, I'm going to take off the right side here, which will later be placed at the top of the line to secure it. And then the second portion has the date that will be placed last. So we'll take this second section, peel the backing off. You can also fold it in half if that will help you by holding the tabs to get it secure. So I'm going to hold the line back, place the notch, matching the notches up, secure one side, and bring the other side through. Secure the other side, and then remove the two small tabs. And next you're going to take your dated dressing that has the date that it was inserted and the date that it is due for the dressing change last. And you're going to place this over the remaining blue part of the catheter, like that. Now that we've dressed the line, it is time to enter the chest x-ray to check for placement and enter the procedural note in the procedural note writer.
That looks perfect. Our checklist is now complete, but let's make sure that we document in Epic. So you document the placement, and I will actually put in a line in Epic there.
Well, now that we've finished with the consent for George's line, I wanted to talk with you a little bit about what we're doing to help prevent infection with this line. And so first and foremost, after the line gets put in here on his neck, we'd like that all of the family members keep their hands away from it and actually not touch it. Our nurses, with fluids in, they're going to be putting an alcohol prep and a cleansing prep on there every time before entering the line so that we can help prevent infection. Any questions on that? Okay.
Yeah.
The things that you can help with would be that if you see the dressing is looking like it's coming loose after the line is on, let one of the nurses know or let any one of us know so that we can either put a new dressing on or put some tape on to help keep it secure. In addition, we'll definitely want, and you will be seeing us using hand hygiene, either foaming in with the hand foam that you've been using as you come into the room or washing your hands before taking care of that line of putting medications in. And then it would be wise to go ahead and ask, how long do we need to keep this in? So we like to keep these lines in as long as they're needed. And as soon as they're not needed, as soon as we can take it out, the better. If he does go home with this line, we've got lots of other instructions. So we'll just wait and see how his condition goes.
Thank you.
Thank you.